So the key messages from today, I think, is to really consider that rhinitis is not simply allergy, that there are subgroups of patients who have a reactive nose with other causes. And also that rhinitis and sinusitis are not the same condition, they are separate phenomena. That's all about making the right diagnosis. When it comes to treatment, there's been a big shift. We expect truly allergic patients to respond to treatment very early on. When we engage patients now about treating their condition, we really want to identify patients who have asthma and rhinitis together and push rhinitis treatment as part of their overall care. We know that not only has benefits for their nasal symptoms, but also for their lung. And then finally, I think we need to be far more engaged at talking about long-term treatments such as immunotherapy with patients, because this provides a long-term pathway at modifying their disease so they don't feel like they're going to be left with local treatments for the rest of their life.